And with that, I would like to invite two speakers to speak today briefly. And the first person is Beverly Walker, who's a Stewards of Change board member. She joined Stewards of Change about 1.5 years, 2 years ago. A little background noise, Mike, if you could mute someone. And if somebody, I'm pretty sure I saw Beverly online. Is she online? Beverly, are you here?
I am here.
Okay, great. So just a little bit of background. So Beverly has gracefully agreed to join our board. And she brought to the table a request to address issues of social and racial equity as a participation on the board. It was incredibly relevant then. It is even more critical now as we think about speaking truth to power and recognizing the challenges. And as I said, not to do harm as we go forward. And that is something I know that Beverly has pursued along the way of her long and stellar career of over 40 years being a change agent in education and human services, working in Georgia and Illinois in human services and child welfare and public health, mental health. She worked for Richard Daley as chief of staff and leading significant human services and educational initiatives. Following that, working at Deloitte, and now runs Public Way Consultancy to support change management on scale. And I'm going to introduce Dave right now as well, so we can just sort of transition over. Dave Ross, who's on the phone, had the great pleasure of meeting Dave a number of years ago on a tour with the Robert Johnson Foundation on Data for Health at the beginning of the Culture of Health work. Dave is currently head of the Task Force for Global Health, Gates Initiative, one of the largest, I believe, and the former director of the Public Health Informatics Institute, a leader in the field of public health informatics. His career has included aerospace and healthcare, public health research, and more recently, global health in particular. He's a recipient of the Hilton Humanitarian Prize for Humanitarian Work. And that's quite significant. Dave has built an incredible reputation and has been able to work at scale on a national and a global level to eliminate disease and build community across the world through the task force, having treated over 350 million individuals with over 2 billion treatments. I asked Dave to speak today because he has a system level view of the possibility of change that is unique and rare. And not only a view, but the experience to actually having done it. And it's been an inspiration for me to think big, to think bold, to think audaciously, and importantly, the power of collaboration to make change through groups, through people, through coalitions. And so I invite Dave and Beverly to address us now and to help us kick off this meaningful experience. Beverly?
So call me BJ, please.
Okay.
People call me that. I want to underscore Daniel's intro around the times we are living in. Certainly the pandemic is one context, but we are also experiencing a tidal wave of conversation and action about racial justice. And I guess my invocation piece today is to implore us to look at our work through this lens, and whatever work we do these days, I think has to pledge allegiance to that conversation and those actions that are happening every day around us, and then do something different because of it. I hesitated to say this, but I need to say it. I know that much of our conversation today is going to be about all lives, and the assumption that all lives matter, and they absolutely do. But we must face the fact that in this nation for too long, some lives simply have not mattered. And we have to pledge allegiance to making them matter. I've worked with public systems, Daniel said 40 years, okay, so I'll own those. I've been a Black woman, a mother, a grandmother, and I'm a great-grandmother. The one thing, though, I have never lost sight of is that poor people in this country, and particularly poor people of color, lead complicated lives. And we need to stop and ask ourselves, why do we keep inventing and reinventing how we serve poor people, the systems that we build to serve them, and we turn around and look and they're still poor? And I don't believe that's a question of what we know or don't know about individual people. It's a question, as Daniel said in his overview, about systems and about why they keep failing to build the safety net that is really, really safe. As we start this work again around integrating systems and sharing data about what we need to know and when and why we need to know it about people's lives, we must remember that we've been here before. I know I've been here before. And each time when I sat at the table around this task, I see us getting the same result. When we worked on it, we got lost in the transactions. We beat our heads against the wall trying unsuccessfully to solve legal, technical, and policy issues. But in the process, we have failed to have a moral compass. I implore us working on this issue this time, once again, it's time to lift up racial justice. We must own it at the heart of the work. I urge us this time to not get so distracted by the transactions associated with interoperability and integrated data systems that we forget transactions are simply the steps we take and the tools we use to fix problems as they present themselves in the delivery of public programs. To get the job done this time, we need to be transformational, because transformation is what will be needed to change the environment within which these transactions take place. And that is how we will ultimately build the kinds of systems that have the capacity to fix people's lives. To truly be honest about how racism is affecting people of color and the health and human services system serving them in this country, we must realize that the disparities and the inequities we see are not individual and personal. They are structural, and they are rooted in things we find it hard to talk about: racism, bigotry, privilege, persistent and pre-existing notions about who people are and why they find themselves in the situation they are in. We therefore often ignore the structural impediments in our social fabric that are producing the problems we see in people who are served by health and human services. We forget to see the lack of educational opportunity, the lack of equal access to healthcare, to housing, to employment, heck, to groceries. In delivering social services, we step over the people because they are complicated and hard. And we too often focus on fixing the transactions because they're easier, and we think we're going to do something to serve folks better if they get fixed. We must face the fact that that isn't going to happen by itself. We often forget to really understand fully how the data we see about people and want so desperately to integrate is really a reflection of the environment that those folks are living in. An environment that has been unfriendly and harsh and unsupportive of their rights to life, liberty, and the pursuit of happiness. Ladies and gentlemen, in this nation, we are not all having the same experience. And our public systems reflect not the lives of those they are designed to serve, but of those whose life experiences can most easily overlook racism and exclusion because they're not affected by it. I realize we all know that simply knowing more about individual people will not improve their fate, but I am not sure we all understand how it might and does reinforce and seal that fate. Let me talk by example. The free and reduced lunch program in this country integrates data about families, and it then allows schools and kids to be defined by a set of social and economic deficiencies. But instead of that giving us a program that promotes racial and social justice, we get a program that targets kids as deficient. It shows up not just when they get their lunch tray, it shows up when they get seen by the school guidance counselor who perhaps pushes them in line for vocational training rather than plotting out their path to Harvard or Stanford. It shows up in a school that no one, even those who live in the neighborhood of the school, wants to attend. Because if you go there, everyone knows that means you are not smart enough and your family is not good enough to get you in a so-called school of choice. As we pursue our work, we need to worry about the inadvertent ways in which our systems and data help us illuminate in people's lives the very conditions we are trying to change. Until and unless we're willing to take on the task of reforming these very systems themselves and the society which for far too long has accepted them and promoted them, because after all, people do get some services and programs, but we need to ask, but to what end? What do I therefore recommend? I like to bring good news with my bad news. We need to be intentionally proactive about helping people understand that solving the data access and the integration problem from government is not addressing how the people we serve got here and got at the doors of these systems. We need to use data to help people stop seeing families, like the Thompson family example, so much through the lens of their poverty and deprivation that we do not see them through the lens of how historically this nation and its systems have underserved them and therefore set them up for the picture that the data presents. After all, we only know what the data says, not what these people say about themselves. We need to use the data we do have to make recommendations that dismantle our current systems and rebuild them. We do not need the current systems to just have better access and more data. We need them to have a different purpose and intent. And we need to lead with a conversation about what the business need is for knowing and sharing data about people. What do we need to know and why do we need to know it? Not just what can we know? And ask the people whose data this is to be part of that conversation and decision. I feel inspired that we can do a different thing this time, but I implore myself and all the rest of us in the work to think differently and through the lens of racial and social justice as the purpose of our work and the context within which people's lives are impacted as the environment in which we want to do the work. Thank you. I appreciate it, and I really look forward to working with you.
Applause would be appropriate now. Thank you.